Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Fluvastatin. Its brand name is Lescol. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Fluvastatin is a cholesterol-lowering agent that competitively inhibits HMG-CoA reductase. It stops the conversion of HMG-CoA to mevalonate, which is the rate-limiting step in cholesterol biosynthesis. In terms of indications for use, this medication is indicated to be used in the treatment of primary hypercholesterolemia or high cholesterol. It can be used in familial hypercholesterolemia as well as mixed hyperlipidemia. And finally, this medication can also be used in the treatment of coronary atherosclerosis. Now, before somebody was to use Fluvastatin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used in patients who have active liver disease. If patients had a hypersensitivity to Fluvastatin or any other component of the product, they would also not be able to use this medication. This medication cannot be used in pregnancy or in mothers who are nursing. And it also cannot be used in patients who have persistent unexplained elevations in their serum transaminase levels. Now, in terms of precautions, it should be noted that the elderly population, so patients over the age of 65 who use this medication, may be at an increased risk of experiencing myopathies. Substantial alcohol use is not recommended while using this medication, as there may be an increased risk of liver dysfunction. Patients with ALS who use this medication should be told that the rate of functional decline may increase with statin use. We should avoid using the medication gemfibrozil with Fluvastatin. Patients should be made aware that hepatic or liver failure has been reported. If somebody has inadequately treated hypothyroidism, they would also be at an increased risk of experiencing myopathies. Strict monitoring is recommended in patients who have a history of liver disease. Aside from myopathies, rhabdomyolysis has also been reported with the use of Fluvastatin. And finally, there would also be an increased risk of myopathies and rhabdomyolysis in renal impairment or kidney impairment. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Fluvastatin, they can expect to receive their dose orally. So if somebody is using this medication to treat primary hypercholesterolemia, they would typically use 40 milligrams either once or twice daily. If they are looking for a cholesterol reduction of less than 25%, they may choose to use 20 milligrams once daily. The usual maintenance dose is anywhere between 20 milligrams and 80 milligrams daily. If a patient was using 80 milligrams, they would typically divide that dose into 2 doses of 40 milligrams. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Fluvastatin, so I'll go over some of those here now. Indigestion can happen up to 8% of the time, and about 3% of patients may experience nausea. 5 to 9% of patients may experience a headache. Some more rare but serious side effects would be pancreatitis, liver failure, muscle disorders, rhabdomyolysis, and the rupture of a tendon. That's all we're going to talk about today with Fluvastatin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.